Healthcare is not a field that I originally wanted to get into. Originally wanted to be into aviation. But what happened is I saw that both, something significant, both of my grandfathers were World War II veterans. And they were misdiagnosed at some point in their health, and we lost them too soon. And I saw a large disparity in healthcare between certain classes of individuals. Those who could afford and could afford to go to the best places to get healthcare, and those who could not, and those who could not advocate for themselves. So I started on my journey in healthcare, not to be in the C-suite, but to become an advocate for those patients who don't know how to advocate for themselves. Many times when you're in a doctor's office, especially if they're telling you that something is wrong with them, all you hear is what is wrong with you. You don't hear anything else, and many people don't know how to advocate for themselves. So that's why I really started my journey into healthcare. How I got to HHM, the short answer is God. I was working at a federally qualified health center in Baltimore, Maryland, as a matter of fact, and got the call, wasn't looking for a job, wasn't designing a job, had bought my dream house in Clarksville, Maryland on 5 acres, and I was extremely happy. And I was gonna make Maryland my home. I'm originally from Chicago. But HHM called, a recruiter called me. And as we got down here and started to learn about what HHM was doing and the possibilities on expanding healthcare in North Texas, I got excited, and I think that's what the Lord called me to do. So the long and short is God.
My name is Ana Dominguez, and I'm 34 years old and 35 weeks pregnant.
You measure in 36 centimeters, that's perfect.
I'm from Honduras, and it's been more than a year and that I have come here for vacations, and well, I like it a lot, and I decided to stay here for a while. I heard this HHM Healthy about it because my friends give me good reference. What I like the HHM Healthy is the quality of care and the commitment with our patients. I recommend them. It's my friends for the quality and good attention I received from HHM Healthy.
You're strong.
For me, it's a place. It's with my home because it's nice to be here.
Can you tell me a little bit about HHM Health?
Yes, HHM Health is a federally qualified health center, which means we get part of our funding from the federal government as a community health center. The federal government, there are about over 1,000 community health centers in the country. And what they're designed to do is to provide health care for those who don't have insurance and those who are underinsured. Here at HHM Health, we have family medicine, we have pediatrics, we have women's care, we have imaging, we're on board in a pharmacy. Here we have behavioral health, and we have optometry and dental at our location. We have 4 locations currently. We're looking to bring on a 5th location in later 2023, 2024. And we provide healthcare for approximately 16,000 unique patient visits that equates to over 55,000 visits per year. So we do a lot to help people. Now, we don't only care for the underinsured or those who don't have insurance. Our doors are open for everyone to provide an integrated model of healthcare with compassion.
Serenity became a patient at HHM Health in November 2020. With Serenity, she was premature, so I was really scared. I had never been through that before, and they just literally helped me through every step. Appointment after appointment, but like calling and checking on me, just like going the extra mile. So it just made me love the doctors. Really, with Serenity, it was just a shock. I mean, I went to the doctor for a sonogram and I didn't leave. I was on bed rest for 5 weeks. And then after the bed rest of being stuck in the hospital crying, can't see my other baby, he started school without me. I mean, it's like just a dramatic change, and then bam, she was here. She was 2 pounds, 4 ounces. She stayed in the hospital for 67 days before she was able to come home in the NICU and in special care. She was 7 pounds even when she finally came home. And at 3 months, she was 11 weeks when she finally came home, which was earlier than they expected, but she still came home. No developmental issues, no issues with eating, no mental issues, just perfect little healthy baby, my little miracle. She had to have like a specific milk when she was premature. She had like, of course I had to feed her on like a certain schedule, so they gave me like all types of just like devices and tools to help me keep up with everything, because it was just so much appointment after appointment. She was very small, so she couldn't use like normal snot sucking tubes. I mean, like they just had small snot sucking tubes for her. They had premature baby pacifiers. They, you know, like diapers. I had a hard time finding preemie size diapers. They gave me free diapers. They, like everything. Really more so though, on a mental level, calling me a lot. That was the help that I really appreciated, because I didn't know how I was gonna keep up well with it, but with them being able to call me and be like, okay, you know, Sariti has this, and this appointment, I'm like, okay, yeah, thank you for reminding me, because I forgot. So they just was really supportive, the support.
How important is, you know, empathy for organizations like yours when you're dealing with, you know, patients who may be having the worst day of their lives?
Yeah, that's a great question. That's what makes HHM so special. One of the things that we do is we start many of our meetings with a prayer. And we don't discourage people to touch each other, to hug each other, to pray with each other, and really to provide not only empathy, but sympathy and compassion for not only our patients, but for our employees as well. You know, everybody talks about, we want to be a family in our organization, but this organization actually lives that out, because we encourage that. You know, people don't come to a healthcare organization because they want to. Who wants to go and step on a scale and somebody tells you you're overweight? Who wants to get stuck with a needle? Who wants to be given a bad diagnosis? No one. People come to us because they have to come to us. And so we have to do as much as we can to leave our personal feelings, you know, at the door, and really be there for the patient. Because it's all for the grace of God that we are not on the other side of that on any given day. So it's important that we treat people the way we want to be treated when we have to be the recipient of healthcare.
Bueno, pues una conocida mía en la iglesia dijo que ella había llegado en una situación similar a la mía, o la de nosotros. Entonces dijo, en esa clínica me atendieron muy bien y me ayudaron, porque ella es indocumentada y aún es indocumentada. Yo fui allá, atienden a las personas pues que como tú de pronto tienen bajos recursos, y las citas son muy económicas. En Colombia no suelen hacer eso, que tengan asistente doctor, entonces eso me parece importante porque lo hace sentir a uno importante. Adicional que son muy respetuosos, miran mucho la situación y como que respetan la intimidad de cada persona, muy profesionales, y nos fue muy bien, fue muy rápido. O sea, ni siquiera nos imaginamos que nos iban a tomar exámenes de laboratorio, ni que a mi esposo le iban a aplicar una vacuna, porque en Colombia eso es más difícil. Y que fuera tan, pues para nosotros es un regalo de Dios porque es muy económico. Porque la experiencia, aparte de que ha sido muy bonita, la que hemos tenido en la clínica, hemos dado con todas las necesidades que tenemos. Por ejemplo, a Sarita ya la van a atender porque ella tiene cuando llegó acá a Estados Unidos se le empezó a caer el pelo y tiene pedacitos no de pelo, entonces a ella ya la van a atender, yo ya le expliqué que allá en la clínica la van a atender, también a Juanita la van a ver de los ojos, ya tiene la cita, y a nosotros dos nos dieron las medicinas y nos la dieron a un costo pues más económico, porque también acá la droga es un poco costosa, pero entonces nos dieron muchas posibilidades, gracias a Dios.
Para mí, la clínica de Healing Hands ha sido mi proveedor de servicio médico para controlar mi diabetes. Prácticamente han estabilizado mi vida porque tengo mi seguimiento, mis medicamentos por parte de la clínica, la atención de parte del médico y de los laboratorios, todo en un solo lugar, cerca de mi casa y con una atención de una calidad que no se puede pagar. Me han atendido de la mejor manera posible, no tengo ninguna queja, jamás han sido conmigo discriminatorios o me han pospuesto mis citas, todo ha sido de una manera agradable y de una manera muy, pero muy cordial. Para mí Healing Hands es compasión, para mí Healing Hands es gratitud y para mí Healing Hands es servicio. Hacerle una invitación a las personas que puedan ver este video para que se acerquen a esta clínica y soliciten la ayuda que necesiten. Ayudas hay, si uno las busca las encuentra y Healing Hands tiene los brazos abiertos para atender a cualquier persona que necesite y no les piden mayores requisitos más que información personal. Para mí ha sido una gran ayuda, para mi familia ha sido una gran ayuda, para muchos amigos ha sido una gran ayuda. Los invito a que se acerquen y busquen la ayuda.
With your wealth of experience, you've been doing this forever, but with employees, compliment wise.
I try to cover the gray up, man.
But there's a lot of people who just come into this. What are some of the things you've learned from some of the new employees?
Oh, it's so much. I learn something from our employees each and every day. The lesson that I get every day is being a better human being. How can we listen differently? How can we truly listen to each other differently? And that's what I get. We have, in our organization, we have patients that speak 68 different languages, which means that 68 different cultures that you're experiencing, and 68 different ways of thinking. How do we learn to actively listen? So I'm learning to listen to people every day. And what I'm realizing, Michael, is no matter how different we are, we all have the same things: love of family, love of self, and love of whatever higher being that's calling us. And then how do we use those things to relate to each other, to provide that, that empathetic, compassionate care? So, every given day, I'm hearing a different story from an employee or a patient that challenges me to think about things a little bit differently and realize just because I may think I'm right, or I may think my train of thinking is the right way, it's not always the right way. It's always different ways to look at things.
I knew that my mom she was, it's kind of a long story, but she kind of ended up in Dallas all by herself. She had memory issues, she couldn't work, and she was on Social Security, but that was all she had. and she had no retirement saved up or anything like that. And so I really turned to Healing Hands because I thought that they could help her, and they did. The first doctor that Mom had, and we discovered, we knew about the memory problems, but she, you know, did some testing, and she put her, she was already taking some meds, but she put her on a second one called Memantine that you take twice a day, and it keeps you more even so that you're not doing this all the time. And it was very helpful. And other things that she's had all her life, like thyroid and a couple things that she's always taken, you know, those kinds of things. But as time went on, we ended up seeing Dr. Lyons, and he came in and he was just like all on it. The thing I can say is Healing Hands took care of us in so many ways that I've raised kids, and all of a sudden I had my mom, and I didn't know what to do, and they guided me along the path, and it was a great place to turn to.
And look how I turned out.
That's right. Look how good
Perfect.
she turned out.
For you, you said a little bit of how you got there, but every day, what motivates you?
Oh man, what motivates me is, when I get out of bed in the morning, I'm able to stand up and to breathe. It motivates me to go out there, try to make a difference in someone's life, to try to be an advocate for someone, to, if nothing else, say good morning and give someone a smile, and try to be the best provider of healthcare that we can possibly be. And people always think of healthcare as a doctor or a nurse, but sometimes, we all need someone just to smile at us and say, good morning, Michael. I hope you're having a good day. And that goes a long way to make your day. And so that motivates me because, when you're driving to work, you can see a homeless person. You can see a person who's had amputations. You will see somebody who might be hiding their hair because they're bald headed, because they're going through chemotherapy. And all of those people need an advocate. They need a friend. They need a friendly face. And that motivates me because I'm given a blessing of being able to get up and to walk into work. So I'm motivated to be a blessing to someone else.
That's a great answer. Yes. You're right, absolutely right. Just saying hello to someone, brightens someone's day.
Absolutely. I know it does mine when I'm having a bad day, because we all have bad days.
Right.
And somebody just says hello, good morning to me. And, I stop and think, well, what am I fronting about? Because somebody just was given a diagnosis of 6 months, and I'm fronting about somebody got my coffee at Starbucks wrong. Is it really that bad?
Right.
We've been at HHM for a while, since I want to say August of 2021, and I lived here in Dallas, and it was really close by. And then in December, things had gotten a little rocky, and I ended up having to completely move our situation and go back home to my parents' house. So we actually live in Princeton, which is in Collin County. So it's about a 35 to 40 minute drive when I do come to the appointments. When Cody was actually in the NICU, before we got discharged, we needed a pediatrician, and they actually referred us over to you guys. So we've been here ever since, and here we are. My experience with HHM Health, it's been great. Ever since we've been coming here, I have felt like very supported, through our journey. And coming from the NICU, Cody had issues, and I just felt like everything was understood. Like the doctors were curious, to want to help in a sense. So I like that HHM is willing to help you and get to the bottom of everything, like health-wise, and just really supportive in those areas.
Where do you want to see the organization in the next 3 to 5 years?
Wow, we're moving quickly, Michael. My goal for our organization was to be the largest federally qualified health center in Texas in the next 5 years. And we're moving fast. For us, we started when I got here last year with 2 locations. We're up to 4 locations now. I would like to see us with 10 locations in the North Dallas area. offering comprehensive health care for any of those individuals who want it, reaching out and serving different communities in the Dallas Metroplex, because Texas is the most uninsured in terms of healthcare state in the nation. So there's a lot of people out there who need healthcare, not just physical health care, but mental health care too.
Right.
And so I want us to reach as many people as possible. And I think, starting with 10 is a good number to be around the Dallas Metroplex serving our community.